Welcome, everyone. Thank you so much for joining this evening. My name is Assemblywoman Lorry Davies from the 73rd District, and I represent South Orange County. We're so happy to have everyone here tonight, and it's amazing the turnout. I think we had like 500 people register to talk about teen mental health. I mean, one of the biggest topics I can tell you that we're getting from our district are questions, not only how do we get our kids back in school, but the mental health issues. Unfortunately, everyone's seeing it firsthand since your kids are home, all day long. Our children were unable to go to school full time and socialize, unable to do their sports. And so now that we're hopefully moving forward on that, it's so important that we really talk about this mental illness, especially the health of our teens. We're really seeing the numbers hit. I know that the emergency wards, they're seeing a huge number increase on overdoses, on mental illness, on depression. So I'm really excited that tonight we've got some incredible people here that are going to be talking about what you can do and what's important, and they'll be answering questions as well. We will be doing questions after our panel speaks. We were able to get questions sent over to us, and then we'll go from there. But I'm going to go ahead and start out. And I'd like to start out by introducing Dr. Heather Huszti. She's a chief psychologist at CHOC. Dr. Heather Huszti is a licensed psychologist and chief psychologist at CHOC. She completed her doctoral degree in clinical psychology with an emphasis in family therapy from Texas Tech University and completed a doctoral internship and postdoctoral fellowship at the University of Oklahoma Health Science Center. She was on facility and faculty at OUHSC, where she was the director of the pediatric psychology program. She joined CHOC Children's in 2002. In her role at CHOC, she had been one of the leaders of CHOC's mental health initiative, which included building an 18-bed inpatient mental health center, which provide treatments for children from 3 to 18 years of age. She also chaired a countywide pediatric mental health system of care task force. She's actively engaged in nationally funded research study to improve the mental health care of our children.
Thank you so much, Assemblywoman. I'll try and live up to even a little teeny part of that intro. Thank you guys for being here this evening to talk about. I often say to people, I'll go anywhere, anytime to talk about children's mental health, because I'm very passionate about that, as I know the rest of our panelists and the Assemblywoman are. If we could do the next slide, that would be great. So I wanted to just talk a little bit about the scope of the problem pre-COVID, because I think we've all sort of heard the news, and I'll talk about the COVID spread in just a minute. But even prior to COVID, we had a very distinct problem with children's mental health in Orange County and across the United States. So 1 in 5 children has a diagnosable mental health disorder during their childhood. And if you think about the scope of that for Orange County, if you guys think about Angel Stadium, I'm sure many of you all have been there, and you fill that up with kids, and then you put 2 more Angel Stadiums full of kids next to that, that's how many children in Orange County have a diagnosable mental health disorder. If you take away 2 of those and you have the 1 stadium left, that's how many kids are actually receiving treatment. So we have an issue and a problem even prior to COVID. We have seen from 2009 to 2018 an increase in mental health hospitalizations amongst children, and that's one of the reasons we built our unit. And we're just a couple of days away from our 3rd birthday. So our unit was actually built even after these numbers. And we have some cities with rates as high as 44 kids out of 10,000. Out of every 10,000 have a mental health hospitalization within a year. We've seen a 32% increase in self-harm visits in the emergency department. And since 2000, you can see that while the teen suicide rate rose 22% nationally, it was more than double of that in Orange County. We thankfully had a much lower rate prior to that, and now we're at the national average, which is obviously not what we want to see. Next slide. And then along came a pandemic and COVID. And what we've seen is, I don't think any of us thought it possible, but an increase in mental health problems across the board with the pandemic. our mental health inpatient center, also known as MHIC, has seen an increase in admissions, and we've seen both more kids that we've had to admit. Our unit's been pretty well full since the pandemic started. But we've also seen kids stay longer because their mental health problems are more acute. That means that they're more serious, they're more sort of top of line treatment. We've seen some months we have an over 100% increase in the number of requests we get for outpatient therapy, people worrying about their kids. And our emergency department has been inundated with kids with mental health disorders. And I'm sure when I say why, I'm sure this picture may illustrate what it feels like some days in homes while you're trying to manage kids and job and, oh my gosh, all the things going on. But we also know that we as human beings do not do well with uncertainty. So that idea of what does that future look like? And really, when we talk to our teenagers, that's one of the key things they say is, I don't know what's going to happen. And when you think about teens, you know, they seem like little adults some days and are very mature at times, but they also, their brain isn't fully developed enough to really understand future, right? And so what's happening right now can often feel like that's my life forever. And so that sense of teens going, I can't even think about what the future is going to look like. Like I'm always going to be stuck in my house, never going back to school. And that can lead to a lot of those problems. We also know that economic downturns also lead to an increase in children's mental health disorders. For every 5% downturn in joblessness, we actually see like a 20% increase in children's mental health problems. So you can see we have kind of a perfect storm, right? Now, I'll give you one piece of good news, because heaven knows we could all use some good news, right? And Assemblywoman Davies did refer to people going back to school, so we're super excited about that. But that also, even as families and kids note the problems and the mental health problems with the pandemic, a survey just came out that was a national survey that also found about 60% of families said the silver lining for them was they did feel closer, and that there was sort of some sense of growth out of the pandemic and all the anxiety and problems that occurred with the pandemic. So we'll hold on to a little piece of good news there. Next slide, please. Now, not so good news is one of the things we know about, and I think it's easy to sort of think like, okay, great. Once we get kids back into school, we get everyone vaccinated, and we can get out again. We'll be done, right? We'll not be worried about this. Unfortunately, what the literature tells us is for disasters, they can have very long-lasting mental health effects. So long after we've sort of cleaned up all the physical things. For children, those mental health effects can last 3 to 5 years. So I think we all want to come together to figure out, how do we best help children? How do we prevent these long-term problems from happening? And how do we really help our kids kind of pick themselves up and go forward to reach as much of their full potential as possible? Next slide, please. So I'm going to talk just for a minute about some of the higher intensity pieces. I know people had some questions of like, when should I worry? How do I know what's a problem with my child? So I'm going to talk a little bit about those. Dr. Belhumeur is going to talk about that second tier, that targeted skill building of sort of how do we prevent and how do we sort of start down that pathway to outpatient therapy and some other types of treatment. And then our colleagues from the San Juan, from the school district, are going to talk a little bit about what are things schools can do to help support children to instill coping skills and do some of the skill building. So you can see that whole continuum of care. But what I do get asked a lot of times for families is like, I don't understand how the mental health system works. Like, what's the right level of care? How do I know where my child belongs? So I wanted to explore a couple of those things so that you better understand what level of care may exist for your child and how I can sort of access that. Next slide. So I'd like to think of this as sort of our continuum of care. And if you think about looking to the left, that's sort of our most severe kind of a child who is at risk of harming themselves. So that's the emergency department. all the way to outpatient therapy. And I'm ending this as an intervention. And then there's beyond that tree, there would be prevention, early intervention, coping skills, those kinds of things. And Dr. Belhumeur is going to talk a little bit more about that. So when we think about it, I think sometimes people sort of are like, oh my gosh, my child's having a problem. Maybe I should go to the emergency department, and maybe they'll hospitalize them, and maybe that will make everything better. So let me explain. The emergency department is really there for kids who are at risk of harming themselves. So if your child's talking about suicide, talking about hurting other people, the ED is absolutely the place that we can evaluate and figure out what's the right level of treatment. A mental health inpatient center, we really think about that as the ICU of mental health care. It's there to stabilize kids, get them past that sort of life-threatening crisis, and then move them into a lower level of care. It's not going to fix the problem, and not every child needs to be on an inpatient unit. So sometimes you might take a child to the emergency department and we might go, we actually could provide some supports in the home, and that would be in-home crisis. We can provide some outpatient therapy and they should do okay. That's actually good news. And I know sometimes it's scary to be like, I took my kid into the ED, or I'm really worried about my kid. Don't they need to be in the hospital? But we always want to treat a kid in the least restrictive environment, right? We want to treat kids, keep them at home with their parents if at all possible. So we look at all these other types of things, this intensive outpatient program, partial hospitalization. That's where kids stay at home, but we do a lot more intensive treatment. Or we can also look at outpatient therapy, where we might see a kid once or twice weekly just for an hour, and we can maintain kids at that level of care. Next slide, please. I also get questions a lot from parents about, well, when do I worry? Because, I think the sort of underlying thing about being a parent is like worry, right? About my kids, are they okay? How do I take care of them? And mental health is one of those things that's like, who taught me, who teaches us to know when to worry? So I like to look at a couple of things. One is the problem persistent? So does it occur more often than not for a longer period of time? And when we say longer period of time, we think about a 2-week period that more often than not, kids are exhibiting depression, anxiety, social isolation, not sort of like, hey, they came home from being with their friends, they went to their room, they slammed the door, but the next day they come out and they're okay. And then it happens again a week later. We don't necessarily think of that as persistent. Also, is it pervasive? And I know right now it's hard to be like, is it occurring in more than one area? Because pretty much the home is the one area. But as they move out of the home back into school, to church, to other kinds of activities, sporting activities maybe, is that same problem occurring across a couple of different places? Then we also would worry more. And then we also look for kids for changes in normal behavior. And that's true for teens as well, especially things like sleeping, eating. So are they sleeping more, waking up in the middle of the night? It's a little hard to tell sometimes because teens tend to go to bed late. That's kind of how their circadian rhythm works. But are you seeing a difference? Are they eating more, eating less? Have they stopped relating with friends, not engaging in self-care activities? And is it causing some problems in their daily living? And if you can answer yes to these questions, then that would be something that I'd want to go and ask my pediatrician about, or access a mental health provider. And Dr. Belhumeur is going to talk to you a little bit about some great resources to help with that in South Orange County. So super excited about that. Next slide. So in this slide, these are just some numbers you can call. The 1-855-OC-LINKS is a number that is more and more having all the different resources sort of with it. And so that's a great number to call. You also can, these are numbers to call if your child's at risk and maybe saying that I'm worried about harming myself. You can call the OC Links line, 911, or some of these other numbers. And then last slide, please. And thank you, Chloe, for putting that in the chat. And then CHOC actually has some specific resources on its website, and Dr. Belhumeur is going to talk about some additional ones. But on our website, we do have access to the blogs. We wrote about 27 different blogs about how to manage during this COVID crisis. Our mental health toolkit has a number of different handouts for parents, for teachers, for pediatricians. Our coping strategies videos has videos actually of our psychologists demonstrating deep breathing, meditation, guided imagery, things that we know help calm stress down and help kids with that kind of stress. And then we also have some tips on how to manage anxiety and how to manage depression. And I see a question right now of, can we share that? I would be more than happy to share the presentation. And I'm sure Chloe can work her magic and figure out how to get everyone access to that for those tips. So I will stop here. I know we'll have a chance for some questions in a bit, but I'm going to hand it over to Dr. Belhumeur, and she's going to talk a little bit more about some of those other levels of intervention.
Before we do that, if that's all right, I would love to just give a little bit of bio on Dr. Lorry Leigh Belhumeur. And again, Dr. Huszti, thank you so much for your incredible insight. Greatly appreciate it.
My pleasure.
I have to do a little bragging for her. It's only fair. All right, our Dr. Lorry Leigh Belhumeur is a licensed psychologist serving as a chief executive officer at Western Youth Services for over 20 years. She received her PhD and MA degree from UCLA. Under her leadership, WIS has evolved into an innovative organization that operates today. WIS annually provides integrated mental health services to over 50,000 clients, both directly and indirectly, with support from our collaborative partnership. As a seasoned community leader and fierce advocate for children, youth, and families, Lorry has led the charge that reexamines mental health in the context of adverse childhood experience and offers solutions that not only treat the predictable negative impact of ACE, but looks upstream to prevent them from happening in the first place. She believes that the foundation of positive mental health in children and youth is having a caring, dependable adult who believes in them and uncovering their strengths and using them to heal. When people are served from that perspective, they become more confident and resilient. They make progress and create and lead successful lives. Doctor, please go ahead. And again, thank you for your time.
Oh, thank you so much, Assemblywoman Davies. It's such a pleasure to be here and to be part of this such an important discussion about youth mental health. Next slide, please. So what I'm going to do is I'm going to talk about, as Dr. Huszti mentioned, we'll talk about specific with regard to the different tiers, the foundation of prevention and targeted intervention. And I know that a lot of the questions were geared specifically for how can I access resources? So that's sort of how I'm going to focus on specific ways that you can access resources for children, specifically in Orange County, all over the county, and then some sort of plug and play, if you will, resources that are available. And I know that, Heather Huszti did a really good job of describing that top tier of really intensive services that are available, outside of outpatient or up to the point of outpatient. And that's really, again, when we're talking about outpatient, it's for those kids that we talked about that you referred to, of like the stadiums full of children that have diagnosable mental health disorders. And so when we look at the resources that are available, it's like these are like entry points into the children's system of care, children and youth here in Orange County. And we have opportunities to help navigate through the system of mental health care for children. And one of the things that we know is that, it's really sometimes difficult to take that first step. And when you run into a barrier of asking for help and you don't know which phone number, you don't know who to call, what we found is that we have access coordinators here at Western Youth Services that will answer the phone, answer the email, and literally help navigate and provide and direct and link into specific, very precise services that are available. We're not a crisis hotline, so if your child is in crisis, do everything that Dr. Huszti just said to do. But if you have questions about it, and it's for any Orange County resident in Orange County, we have an outreach and engagement program. Specifically, it's located in Mission Viejo, but we are literally out in the community. When the community opens up, we'll be out there even more. But we're on school campuses when they're open. We're in food distribution lines at schools for the reduced lunches, handing out these flyers saying, here's how you can access some of these resources. So you have the contact information there. It's a toll-free number. Email us at info@westernyouthservices.org. And what this is again, the skills-based, solution-focused services when you suspect that your child or a child in your care is experiencing some emotional distress, and certainly now, as we've seen with COVID, more than anything, like the acuity level is so much higher. So it's really, if when in question, just give us a call. So what we offer at Outreach and Engagement is we have trained professionals, licensed counselors that provide short-term therapy. What that means is anywhere from 1 to maybe 6 sessions at the most to get over, to learn skills, new skills. They're maybe related to grief and loss, or learning coping skills to deal with minor levels of anxiety, those kinds of things that'll respond to short-term therapy. And if you don't know if they will or won't respond, still access the resources anyway, because we will do the linking to other resources. So again, this is for any Orange County, South County resident. Can call this number. If you have insurance, we'll help link you to the resources that are available through your insurance company, all of that. Let us help navigate through the system with you. So there are also skills-based groups and one-on-one skill building, educational workshops that are available to teachers and other professionals, but also parenting skills, how to deal with youth's anxiety as a parent, and things of that nature, where if you're just wanting to build certain skills in this area, again, we have those educational workshops as well. So the referral, linkage, and resource navigation is what I was referring to, where we have someone who's like an access coordinator that are going to identify what's the appropriate referral. And this isn't just for mental health care, because what we also know is that some of those economic and other contributing factors that kind of go along with depression and anxiety and things of that nature. Sometimes when we solve different kinds of problem, like access to childcare or access to emergency resources, like emergency funding for an electric bill or things of that, sometimes just dealing with those economic things and helping navigate that system will actually have a positive impact on the mental health and well-being as well. So we have the referral list and linkage and resource and help navigate. And then we also have outreach events. Again, when we open up, these will be more, but outreach and events in the community, that means we go to places where people are naturally congregating and offer our resources in education and letting people know how to build resilience. What in my bio, we talked about adverse childhood experiences, ACEs. Those are traumatic events related to abuse, neglect, family dysfunction, and other related life events that we know are associated with the onset of depression, anxiety, and post-traumatic stress disorder. So we talk about how to recognize those and what things we can do immediately in the lives of children and families to help reduce that stress that's associated with adverse childhood experiences and the related life events and things that are really impacting the stress response. So we have these outreach events that are really, again, tied to identify what are some of the prevention efforts that are underway that where we're looking at it like, we have those stadiums full of children that have diagnosed mental health condition or diagnosable mental health disorders. What we're doing is we're approaching it also from the prevention side and then coordinating efforts with CHOC Hospital and others that are providing those intensive services that are so needed when kids are in crisis and things of that nature. So this outreach and engagement, again, is available to all South County residents, and that's our contact information. Next slide, please. So we have another program, and this is for any CalOptima member. So what we, again, have determined that it's way easier if you have one point of entry into the healthcare system, and then let us help navigate. So for any child, any family that is a CalOptima member, where we are connecting children to CalOptima mental health services through one simple phone call. So if you have CalOptima or you know someone and you're trying to help them navigate, you see that the provider book is like a phone book and there's like hundreds of providers, but you don't know which ones are accepting referrals, which ones see children, which ones have expertise in a particular area. We've done all of that work for you. And so there's one toll-free number and one email. Again, easy access info@Western Youth Services. This is a different number than the South County residents. This is for CalOptima members only. And so basically what we're doing when we're talking about mental health access coordination, what we're talking about is coordinating access to that first appointment with a CalOptima mental health provider. And we also provide mental health screening. So on that first call, we'll be doing a screening to assess what level of support and treatment is needed during that call. And if we do notice that you need a higher level of care than outpatient, that's when we do the linkage and referral into a higher level of care, which may be CHOC. We find the best provider for your child. Again, we've vetted and we have personal relationships with many of the people who are on the provider list because we know which ones are currently taking referrals, which ones are treating children. We've again done all of that, that legwork for you to do that. So we're also in this program, we problem solve through the barriers to get you connected to providers. Sometimes there's language needs, sometimes there's a specific access need. And so we navigate that for you and we stay involved until the child is connected to the resources. So we have an ongoing list where we're making sure that children are connected. It isn't just call this number, it's actually a warm handoff to a referral. And again, this is for any CalOptima member. And I see questions in the chat and I'm gonna keep going and I'll get to those at the end. But this is again for CalOptima members. There's a toll-free number specifically for this. We call it CMHA. We use a lot of acronyms, but basically it's a one-door access, one door to get into access to mental health services for kids that have CalOptima. Next slide, please. Now, the other thing that I'm really, really proud to say that this is the Reset Toolbox is a collaboration with CHOC and the Orange County Department of Education, along with a lot of other resource providers. And the way this Reset Toolbox, like the thought of it was right at the beginning of COVID and right at the beginning of the shutdown of schools, there were a number of psychologists in the county putting our heads together saying, we already know that there's going to be mental health implications because of this pandemic. And so we were thinking ahead and saying, how can we prevent the onset, if we can, of PTSD and some of those other traumatic reactions as a result of this. And back a year ago when we were thinking about it, we had no idea that it was going to go on for over a year. And what we did is we built this infrastructure, this reset toolbox, and it's resilience, essential social emotional training toolbox that has tons of resources for live trainings, pre-scheduled trainings, and there's a ton of topics, and the trainings are for community, consumers in the community, students at different ages, parents, teachers, school administrators. And basically what we've done is we've vetted hundreds of resources that have been available out there, everything from Sesame Street to resources that are provided and available at Yale, for resilience building. And we've really put them all together into this reset toolbox. That's the website there. And there are no cost, there's no cost to any of these trainings. And one of the things I know that one of the questions that's going to come up later is about screen time and being online and kids being online and spending their time online. And one of the resources in the toolbox is training provided by the Center for Online Safety. And it's live training and pre-recorded training on how to recognize the danger signs of too much screen time, how to make your child's devices safer, how to set them up, literally how to set them up and feel more comfortable about being online. And we know that that was something that people were asking for when we set up this reset toolbox. Another thing, I was in a meeting yesterday and they were talking about consumers were saying we need tech support in order to access telehealth, in order to access online learning, all of these things. We need somebody who can help us navigate the tech support to be able to benefit from these things. And we've got guided technology support available at no cost to you there in the reset toolbox. So these aren't specifically mental health services that are available in reset toolbox, but they are resources that are designed to really help support the mental health needs that have come up as a result of this pandemic, which is what the reset toolbox was intended for. There's also intervention strategies for handling behavioral difficulties in the classroom, conflict resolution. There's training on, again, with grief, suicide prevention, restorative justice trainings, lots of things that have come up. And again, we've vetted all of these resources in the forms of online training, in-person training, live Zoom trainings, apps that are available that we've vetted and that are being created, and we'll keep putting them in there. So this is a place where if you just are looking for resources on your own time at no cost for you, it's easy to navigate, easy to sign up. There are places that say pre-register. If there isn't a class currently available, within the next week or so, you pre-register and then they create the class as things come up. So it's really an amazing resource, again, that was created as a direct result of the mental health professionals in the community saying, what resources are these kids going to need in order to navigate their social emotional learning as a result of a direct impact of this pandemic. So that is the other thing that I had. And I think that concludes my part of the training. So I'm going to hand it back to you, Assemblywoman.
Great.
And yeah, if there are questions, I can take them whenever the time comes.
Fantastic. Well, thank you so much, Dr. Belhumeur. I mean, again, important information, and this is being recorded. We'll make sure that everyone knows where they can see it. And thank you for staying on for some questions later on. All right, our next panelist is Mr. Omiro Correll. and he's going to be standing in for Superintendent Kirsten Vidal Brutti, who had conflict this evening. Mr. Omero Carell is a middle school counselor at Las Flores Middle School, and he's going to speak on resources available to CUSD students and families, and remain also for question and answer. Thank you so much for coming tonight.
Thank you, and good evening, everybody. It's a pleasure to be here with you all this evening. And I just want to start off by saying our capital counselors, I would say, it's probably a biased opinion, but we are an amazing team, an amazing group of individuals. We have amazing leadership at the top: Wendy P. Pospisil, Rebecca Pianta, and Jenny Tai, who really help our counseling community to really understand, really be organized, and direct services, resources, and support to all our families. We do that as a team. We do that on a grade level. And so just generally speaking, our counseling team is united, ready to support and provide support and services. If you do a quick search, Capital Unified, our district website, and just look for the school counseling program, you'll find on the far right all sorts of resources we're all well versed on. You could go there this evening while I'm speaking to find them, and even your particular grade level, whether it was elementary, middle, or high school. We have resources on our website that not only do we share, but you can access at your leisure. There was a great pyramid that was shown earlier in support and understanding student needs when it was spoken to earlier, and for ourselves as well. We communicate through an MTSS model, multi-tiered systems of support. And just not to break it down too far and take so much of everyone's time, but at that bottom level, that tier 1, those are services, supports provided to all students, all families, definitely promoted, highlighted. A lot of people should at the very least hear of these types of services and supports. And something there you might all be aware of, this goes with the topic this evening. We have social emotional learning in our school district, lessons that are district approved, are brought out prior to COVID-19 and the pandemic. Many of us, most of us would present these lessons in person, teach class to class to class, and would support our students' social emotional learning that way. We've pivoted this amazing team. It's online. Students are accessing the same curriculum, the same lessons, and it's on that tier 1 base. All families should have some awareness to it. All students are supported with these lessons. We also have monthly webinars, so not to plug it too much, but on the 27th, coming up shortly, we do have another counselor orchestrated webinar for our parents. I believe it's titled Nurturing the Nurturer. So we understand that our students not only need our support, but their parents who are parenting these students might need some support as well. And as we collaborate, we come together, we put resources such as the April 27th webinar that's coming up. There's PBIS promotion. Those are promotions for positive behavior, intervention, supports. A quick call to your school counselor. I'm sure they'll specify what that means at your school. And I highlighted our district website resources. So there's a wealth of resources to all our families as you move up that pyramid, tier 2, maybe more specific to specific groups that a counselor might run. We're well-versed in restorative practices, and with parent permission, we provide specific interventions that are restorative practices in themselves. And in PBIS, there's also specific interventions that may be provided sometimes to smaller groups of students, all the way to get to the top of the pyramid, where you are at that tier 1, where that's where a specific student is highlighted to be supported. And some of these interventions I mentioned, we may definitely focus and support them with. So I'm very proud to be a school counselor here at Capistrano Unified. I love Las Flores Middle School, so anyone out there from Las Flores, good to see you again. But it's a privilege to serve this district, and I really just do recommend that you reach out to your school counselor if you hadn't just yet. Get to know them, inquire a little bit more, anything of all this amazing information that was shared this evening. Feel free to just have that conversation, so that way that school counselor who is well-versed in all sorts of counseling supports can better provide supports to your child. And I thank you so much for the time, and I do have a couple questions I'll be answering at the end, and I'll drop in the chat. There's a nice little highlight video we all worked on this year, but it's a pleasure to be here with everyone this evening.
Thank you, Mr. Corral. Greatly appreciate it. where we're going to bring up our panelists. And we received quite a few questions, a lot of them coming from the school questions that they were receiving, as well as our doctors. So we'll go ahead and we'll let you all jump in, and do know that we will have, we'll send in the chat an area that if you don't hear the question that you would like to have an answer for, we will take that and get that information to you after we're done with this. All right, so we'll go with the first question. All right, how do we best support our teens in recovering from the mental impact of COVID? I'm worried about my child's ability to focus, and I'm seeing increasing tendencies for them to isolate themselves.
You're muted.
Man, someday I want to go through the whole day and then have to unmute myself, but haven't happened yet. I'll just say, I think sort of twofold. I think it's easy for us to sort of put some of what our expectations were before the pandemic on this sort of strange time within the pandemic. So one thing is, to give kids a little grace that we're all, and ourselves as well, that we're all kind of struggling to figure out how to adapt to what's going on. And I think, Omero, I'm sure with your school as well, you guys have, I know the schools we work with too have had to do a little bit of adjustment of how does that work and expectations. And I do think, to go back to the reset toolbox, and Dr. Belhumeur, you can certainly chat about that. I think there are some strategies on how to engage with friends, social skills, things like that to kind of bring kids back up to speed after a year of isolation. I think there are a lot of kids who are a little anxious about getting back to spending time with their friends. So I'd start with the easier piece and then kind of work your way up. If those things aren't helpful, then we might think more about, do we need some short-term interventions or some longer-term interventions because we're a little more worried about depression or a diagnosis of some kind.
I think to piggyback on that, Heather, I really like the schema that you had in that one with all the bears, on that slide. And I know that they're going to happen it out. So if you're really seeing that it's, persistent, if you're seeing those signs of a serious issue, that's when to, seek emergency help, as you mentioned, and then access the other resources. Certainly start with the counselor at the school. Heather, you mentioned the pediatrician as well as being a great resource. And then certainly the numbers that we provided as well. If you just have any questions or doubts about it.
Thank you very much. Next one, which is, something that a lot of parents are dealing with right now, is how do you know if my child is experiencing depression, drug use, or suicidal?
I think it's always hard. And I'll just say it in the sense that kids want their parents to think the best of them, right? And so a lot of times we do kind of hide things from our parents, even though because they're the most important, most connected person to us. That being said, I think there are ways to help draw kids out better. And I think asking those sort of open-ended questions, maybe watching some TV together or watching a movie together and be able to say, well, what do you think about that? Or asking kids things like, what are things your friends are worried about? So it doesn't feel quite so in my face and personal of what's going on with you, which teens often are sort of like, I can't talk about that. But when you kind of open the door a little bit, often kids will walk on through.
All right, great. This, Mr. Krell, we'll hit you up with one here. My child is not doing well in school. I'm worried it's affecting their self-esteem. What should I do?
Sure, and that's a very valid concern that parents do have. And what we definitely look to align ourselves is with the National ASCA model. That's American School Counselor Association. And we talk a lot about having like a community sense or school stakeholders. If you do feel this directly with your child, I tell parents all the time, your school community is with them at least 50% of their waking day, Monday through Friday. So if you see this, definitely if you have that level of communication with them, get some insight from them, but maybe inquire more from the teachers who may see them on a daily basis, the school counselor who may be meeting with them one-on-one, And if you haven't yet gotten to the counselor, starting with the teachers, your school community, in that way, starting with your student, and then bridging the communication with the counselor, that's going to really help to like hyper direct services support. I mentioned a bunch when I spoke earlier, but if that is a concern you have for your child, which is completely valid, getting that time and investigating the situation from different perspectives, in addition to what you see, after taking notes of all the great information that was shared tonight as well, that's really going to help the counselor to support your student, to really get in there directly instead of taking a little bit more time to try to figure things out. If you do have that ability to connect, even if it's a late email to a teacher or a late email to the counselor, they will get to you as soon as they can the next day, 48 hours at the latest, but then that will be able to better support the self-esteem of your child. And then you can build from that. If there's any linkage to outside services and support, your counselor, with parent permission, from my understanding, can then communicate and provide more support if professional outside therapy or counseling does ensue in supporting your child's self-esteem.
All right, Dr. Belhumeur, you had kind of mentioned this. What is a reasonable time that children should be spending on social media?
I was prepared to answer that question, and then I looked at our resource on the Center for Online Safety, and I would say if you have that question, go there to see, because every parent's tolerance for a level of time online differs, because some parents themselves spend a lot of time online, and so their version of how much time a kid should be spending. So I don't mean to defer the question. The thing really is for children and parents to feel comfortable that their child is safe while they are online. And so, even if it's 15 minutes or if it's, 5 hours, it's really that safety issue. And there are applications that school districts have access to that get triggered if there's concerns about safety, or if a child mentions the word suicide or harming themselves or harming others. There are ways to actually get notified as a parent for those things. So I think that, I don't know, Heather, if you have or Omera, if you have a better answer for what's an ideal amount of time online. I think really the focus is feeling for parents to feel comfortable that their kids are safe online, depending on whatever parameters they set for their family.
All right, question is, how do most families pay for mental health services?
That's a big question. I think that what I will say about that is that the services provided at Western Youth Services are no cost. If you have CalOptima, if you have Medi-Cal, if you want to access the services that I've just mentioned, they're no cost. And Dr. Huszti, you can talk about the cost related to insurance and other ways. Yeah.
So there is a requirement to cover mental health services at the same level that.
Oh, so what she was going to say is there's a parity law.
Physical health services are covered, and let's put some teeth into those parity laws. Yeah. And so on the back of your insurance card, there should be a behavioral health number that you can call to access behavioral health services. But we do know the system is difficult. So, Lori's navigation is a helpful place. But there are ways to get those services paid for.
Yeah, you broke up a little bit there, Heather. So I filled in the gap of what you were saying. So
Thank you.
So there is a law that says behavioral health needs to be covered at the same level of physical health. And so that's the number to call on the back.
Yeah.
All right, very good. My child's social interaction skills seem to have disappeared during this last year. How do I best help them with this issue?
I don't want to monopolize, but first of all, that's normal. That's a normal reaction to this abnormal situation that we've all encountered. And I think to be open, with that and invite those open-ended conversations about it. really draws, has the opportunity to draw out that.
I would even
Okay.
further add, I mentioned before, we do social emotional learning on the school district. This year, we transitioned over to this online access to the services. There's all sorts of parent sources and tips we can. So once again, it's connecting with the counselor, kind of just providing to them as honest as you feel comfortable to be the situation. From there, they can begin to tailor some items to share over to you. And once again, we can partner with various resources. But having that conversation, dialogue, bridging it over to the counselor would really help us out a lot in what we have, and we do have resources on it.
And
Very
I
good.
think-
Go ahead.
sorry. I
Go
was
ahead,
just going
Doctor.
to add one thing is I think as kids are returning to school and socializing is also think about that bridging, right? So rather than expect I'm going to go from being isolated for a year to back to where I was before that year, you might sort of think about, hey, maybe we get together for half an hour, or maybe we have an activity and we slowly sort of scaffold us back to where we were in the past with our skills.
Very good. Well, we have some questions from the chat. This is if you have a student that has developed some terrible and lazy habits this school year, would you recommend keeping them involved in some sort of summer bridge program or summer school program? Or would you let them take a mental break and tackle these habits in the fall? It's a good question.
Let's not all jump at once.
Yeah.
I thought, Homero, I thought you were going to take that one.
Yeah. We were all
Oh,
looking
know,
at you, man.
Mr. Corral, it's all yours.
Sure. I would just say, you know your child best as a parent. You understand them, and if you do feel and see that you can really push them, for lack of a better word, support them, guide them towards those summer type programs, kind of like as was shared not too long ago, kind of scaffolding, preparing them for fall is ideal if you can. But if you have a child and you see them that's going to be too much for them, they have developed their mental health taken a toll, and however this pandemic has affected them, potentially that might be a route to be. And once again, just consulting with your school community, who's going to be there next year, or the upcoming school, having those bridges of communication is what's going to be great in figuring out exactly what's going to work for you, family.
Okay, our next question, it says, if a child threatens to kill themselves and has a nervous breakdown for about 13 or 15 to 30 minutes, then the next day act like nothing happened and they say they would never do it, but it happens 2 to 3 times again in 6 months, what should they do?
I think I'm just going to say we always want to take seriously when a child makes any kind of threat about kill myself, both from a perspective of if that's the way I'm just expressing that I'm just at the end of my sort of emotional ability to cope, it's better to learn some different ways to do that so that it doesn't scare everybody. And if you really are having those feelings, then of course we want to address them. So I think in those cases, it's worth a discussion with your child. I think as Mr. Corral has also said, it's worth talking with the school about, are we seeing those things in the school as well? And then from there, I think you can kind of decide, I'm seeing this enough that I'm concerned. I want to get this checked out, either through like Lorry, like Dr. Belhumeur was saying, through our screening process or some short therapy to see, do we need longer therapy, but maybe just to address with the child, hey, what's going on that's getting you that sort of worked up to that point? And what can we do to make things better? What can you do to cope better and learn some better coping strategies?
Thank
would
you.
add just a tiny little bit to that as well. Obviously, the depression is concerning. It would alarm any parent. But then if you take anything away tonight, there's 3 things from my former crisis work employment I would definitely recommend that you all consider. Is there a specifically expressed plan in which they are speaking to that suicide? Is there specific means by which they potentially would follow through? And is there a specific intent, date, time? Those 3 things are definitely going to take your concern to the next level in reaching out for support. And when you do reach out, whether it's taking them to emergency room or consulting with Those 3 points are very helpful to get directly, expediently support and services if your child has not only these ideations, but is walking away with specific plans, means, or intent.
Mhm.
Very good. What do you think about a mandatory teacher training on mental health awareness?
Hmm.
I think and I'll let Mr. Corral talk about mandatory. I will say that both Western Youth Services and CHOC has been doing a ton of teacher training within the schools, not mandatory, but doing just as what the school, because every school is different, right? And Mr. Corral has really talked about how fortunate you guys are at Capo that you have a very strong mental health program. There'd be other school districts that are like, not so strong, need different kind of support and care. So we've tried to target that training to what the school needs. I'll let Dr. Belhumeur and Mr. Corral talk about additional pieces to that.
Sure. I mean, I would just share that in terms of mandatory, I'm definitely not someone to be able to speak to that. I would have deferred to Superintendent Vitale at that point. But any way that any one of us can understand a little bit more, we're just that much more helpful to the
Yeah.
which
Great.
knowledge is so good.
Thank you. All right. We reside in Oceanside, but my child goes to school in OC because my husband is a teacher at CUSD. Would we be able to use the WYS services?
Well, what I will say about that are the Reset Toolbox services are online. So those are, absolutely, we have people signing up that are outside of the state of California for some of the trainings, just because that's how it's set up through Eventbrite or something like that. So, those are available. With regard to the outreach and engagement services, they're designed really for OC residents and linking them to resources that are available here in Orange County. But if somebody called, I'm not sure that they would say, we can't help you. I think that there may be an opportunity to link them to other services that are available. And
all right, I'm gonna end with one more question. I know we could keep going on, and thank you so much, but I want to respect everyone's time. But this one is, let's ask the question. Basically, where do they go for help with substance abuse?
I think substance abuse, I think for a long time that's been sort of two separate kinds of lines of service. And one of the good things with what the state's working on now is how do we sort of pull those together, since those problems often overlap. But I definitely think, your pediatrician, if you're already with a mental health care provider, they should be able to help you. And Lori, I don't know if your sort of linkage services include substance abuse services as well.
We do. The resources would link them to other, we would triage and identify, what's the nature. I think the point that, you're making, Dr. Huszti, is that it used to be mental health and, drug abuse or substance misuse, and it's behavioral health. And so all of our programs are behavioral health, which means it's looking and assessing for both of them and then determining which one is the greater need. Is substance abuse or misuse and drug abuse or alcohol abuse, is that the primary issue, or is it, and the mental health is secondary? And it's really up to the assessment process to determine which one is higher. But our linkage programs absolutely do that in the triage, and we have access to those resources that are available here in Orange County.
Awesome.
Well, I want to thank all of you, Mr. Corral, Dr. Huszti, and Dr. Belhumeur. Thank you so much for just the experience, the insight that you've offered. I can tell you by looking at the messages in this chat, people are so appreciative to this information. It's been a hard year and a half, and we want to get, we know like this mental health, this isn't just going to go away once the kids get in there. You're going to see the teachers are going to be dealing with this as well. It could be for a couple of years. So thank you for your insight. Again, we'll have this up on our website by Thursday. but all the information as well. They can contact you and move from there. So thank you. Greatly appreciate it. Obviously, our children, our teens, I mean, that's our first priority.
Yeah. And
Thank
I
you.
just noticed, if you'll let me just
Please.
1 second, there was a question in the chat about parents of teens. Absolutely. Reach out to Orange County outreach and engagement in South Region. If you're a parent, the resources are there for you as well. So just wanted to make that clear.
Thank you.
All right. Thank you so much.
Good night, everyone. Thank you again for participating. Greatly appreciate it.